plus 5, which is equal to 13.
Yeah.
So that child may become the joke of the class.
Yeah.
And if you have a teacher that is not sensitive to visual problems,
yes,
in our olden days, we used to be beaten up. The stick was one thing that was always on hand, and the teacher will just punish the child and not understanding that there is nothing wrong with the cognitive ability of the child.
Yeah, yeah. Just you know, we had some problems earlier with the transmission, that is the live streaming. We've just managed to sort that out, so people can be able to follow us on YouTube, on Facebook, on Instagram, and also you know, on Twitter. Apologies, sometimes technology doesn't always work with us, but we have not gone far with our discussion. The topic of today, it's about Eye Care Awareness Month, which is a period during the annual health calendar that starts from the 21st of September to the 18th of October. During that period, there is normally a lot of awareness that is given to the general population about the importance of eye health, especially around issues of prevention and treatment of avoidable blindness. So we have our guest here, Mr. Sibusiso Gumede, who is an experienced, qualified optometrist who practices in Durban. Now, Mr. Gumede has just been taking us through to understand how often should one go and see an eye care professional like him. And he's telling us that at least once a year, one should go and see an eye care professional. Whether you've got a problem or you don't have a problem, you must go and see an eye care professional. But also, he made us aware that some people, because of their health situation, their eye care professional may tell them to go and visit them much more often than once a year. But also, he also told us that medical schemes tend to pay for one visit every 2 years, you know. So what I want to know from him then is if it's possible that an eye care professional like him can motivate to a medical aid to say this routine once a year, so you know, once in 2 months that they pay for, may need to be relooked for a particular case, meaning rather than waiting to go once in 2 years, you go once a year because there is a motivation from a professional like him. So maybe you can answer that, Mr. Gumede.
Look, Fundi, again, you're putting me on the spot. My approach to that kind of a situation is you as a patient, you have a say on where your money should go.
Yes.
And who will take better care of your needs.
Yes.
If you are aware that you have a condition that is threatening your vision, your livelihood, you should look in the marketplace for a medical aid that will make sure that your needs are fully covered. I haven't had very good experience with motivation letters. Okay. I have to tell you.
Yes.
I have to be upfront. You write motivations after motivations with very little, if any, success.
Yeah.
And that always puts practitioners in a very uncomfortable position because you are aware of what is happening here and how important it is that intervention is given to the patient as soon as possible.
Yeah.
But let me give you an example. Let's talk about keratoconus.
Yeah.
As an example, we're not going to go into details about the condition. Keratoconus is a degenerative condition of the cornea where early stages you find that a person, a patient,
Yeah.
after 3 months of having received his spectacles, the spectacles they no longer work, goes back to the optometrist, and truly the vision has deteriorated. And then if you have an optometrist who is not very careful, will prescribe another pair of glasses, and in another three months' time, the patient is back. And truly, the prescription has changed. And then if you don't have somebody who pays attention to detail, who will understand what is really causing the situation of the eyes degenerating at such a fast pace.
Yeah.
Until such time that even glasses now, you don't even get um, any effect with any spectacle lenses in front of the patient because the cornea is degenerated. It has thinned so much and has changed from the round structure to a conical structure. And then with that happening, any change in movement that the patient does, it will be accompanied by changes in the shape of the cornea. That's why glasses will no longer work. So you need now to prescribe hard contact lenses, which will now push the hard contact lenses, not soft contact lenses. The hard contact lenses then will push back that cornea, and the contact lens now will actually form the the artificial anterior surface of the cornea. And now you've got a medical aid that says we don't pay for contact lenses because we have made this blanket decision that contact lenses are cosmetic. No, not all contact lenses are cosmetic. You've got therapeutic contact lenses, like in this particular situation. And then you find yourself having to sit down and write motivations to the medical aid to say that the only option that we have here for this particular patient is contact lens correction. Will you please? You still do not have any joy, even under those extreme, obvious conditions.
Lovely, lovely, lovely. No, I'm happy to hear that. So now we have settled the frequency. We have settled, the difference between an ophthalmologist and an optometrist. Now, if we talk about people with pre-existing health problems, chronic problems, we talk about diabetes and hypertension. Can you talk to us about, the kind of challenges that those kind of people with chronic problems like diabetes and hypertension, the kind of problems that may happen with their vision, which is why it's so important that they come and see a professional like you?
Thanks, Pele. The example that you have cited, you're well aware they fall under the vascular disorders.
Yes.
And with that, it's very clear that blood flows in every tissue in the body. So if you've got elevated blood sugar level, that sugar will be also carried to the eyes. And you have a range of associated problems due to diabetes. You have changes in the back of the eye, retinal changes, where your blood vessels now, because of elevated blood sugar levels, they start leaking blood into the retina, where that blood is not supposed to be there. It's important to understand when you're talking about clear vision, it's like if you've got water in a clean glass, you've got fresh water in a clean glass, you will be able to see through on the other side. But the moment you start introducing a drop of any color, then it will discolor the eye, like your hemorrhage. Then, if the reaches hemorrhage, obviously that patient will see that as a spot. So those are some of the changes that we see. And long term, you've got cataract because elevated blood sugar level. So those are the kind of changes that you see. And sometimes you find that no matter how hard you try to manage the retin or the eye-related changes, if the patient is not taking good care of the management of diabetes itself, you're not good.
All right. So basically, I used diabetes as one of the common chronic conditions that may lead to a problem, with the eyes. All right. Now, I would guess, also with people with high blood pressure, because also they do present with eye problems a little later. So would you say the same thing with people who've got diabetes? They must also, make sure that they keep a high index of, suspicion, and actually be able to go to see, an eye care specialist like you, because of the possibility of eye problems, that may be related to their medical problem.
Absolutely, Ben. Absolutely, Ben. There are hypertensive retinal changes that we see. The most common one would be at the level where the artery crosses the vein. Again, Ben, it's important to highlight we're very fortunate as eye care providers that use instruments like your ophthalmoscope. We can see the blood vessel in situ live, and you can see what is happening inside that blood vessel. Like at the level of crossing of the artery and the vein, you can see that there are changes that are associated with hypertension, and you have the retinal changes as well in the form of spots that have the retina changes its pigmentation, and you can tell that this one is more hypertension related and this one is diabetes related. It's very important for those people. Once you've been diagnosed with those systemic conditions, it's very important that not only do you consult your physician, but you need to have a good relationship with an eye care provider.
Lovely. I think that is what I wanted that message to say. If you have been diagnosed with a chronic illness, especially hypertension and diabetes, it is a must that you see a healthcare professional, an eye care professional who must keep track of what's happening in your eyes, because the risk of something going wrong with the retina, which is the back part of the eye, the part that actually creates, the images before they are interpreted by the brain. So thank you very much for that advice, Mr. Gumede. Now, so that was for people with chronic illnesses. But somebody who has never had a chronic illness, somebody who has no family history of eye trouble, you've already said it's still important for them to go and see an eye care professional at least once a year. Now, what kind of things are you likely to see? You talked about short-sightedness and long-sightedness, problems that have to do with the lens. Can you just talk to us about that? Now, this is somebody who's got no chronic illnesses, but it's an issue of the lens.
I think, Pele, at this stage, let's just look at a human being from birth
Yeah,
until death.
yeah,
As soon as a child is born, if you have a pediatrician who is struck, you are immediately aware that there are some challenges
yes,
that the child may possibly be born with.
yes,
Congenital conditions.
yes,
You may have congenital cataract. A
yes.
child is born with cataract. Immediately we are called upon to say,
Sorry, Spoo.
yes.
Are there some people behind you? Because there's a bit of background noise that I'm picking up.
Okay,
Sure.
let me try and attend to that, please.
Yeah.
I'll be with you now. Thank you.
Apologies for that. We just want to make sure that you've got a good transmission. So as I'm sitting here, I'm picking up some noise behind Mr. Gumede. And
Oh, thank you. Well, I had my window open, so the neighbors.
okay, lovely,
I
lovely,
have
lovely.
thanks. Thanks.
So you were still telling us that the issue of eye care doesn't come when somebody is old. You start
No,
from birth
day one.
because there could be conditions that a child is born with that may
Yes.
affect their vision. Yeah, you can continue from there.
You may have conditions like I've mentioned earlier, like cataract, coloboma of the iris, coloboma of the lens, congenital aphasia, where there is failure of the lens to develop.
Yeah,
You know, you may have strabismus, where the child is born with what people call the squint, congenital squint, all those things. So as from day one that the child is born, you may be summoned to assess the ocular health of the child. So without any previous history, like you mentioned earlier,
yeah,
so let's say that the child passes the test and the child is normal, then that child needs, like we have explained earlier, annual checkups. But there are certain stages which I feel that a human being should never, ever, ever miss, during which a human being must never, ever miss
yeah,
the eye checkup. For
yes,
example, that child, before he even goes to school, any child, before he even enrolls in any school, a
yes,
child needs to have his eyes or her eyes tested by a professional to make sure that he is able to follow what is discussed in class. Even the example that I cited earlier again. And then the next stage will be puberty,
yeah,
when now you have a child being transformed biologically
yeah,
into an adult. The hormonal changes that happen then, again, you need to make sure that during those changes, the eyes are not affected.
yes,
And once you are 40 as well, because of the degenerative conditions of the elasticity of the structures inside your eye that control accommodation,
yes,
particularly your lens, your suspensory ligament, and the ciliary body.
yeah,
With that loss of elasticity, I'm sure, Pele, you have once in your life been exposed to that condition where all of a sudden now you're picking up any reading material, and now you find that you can't read, and now
yeah.
people, they find that they have to stretch out their arms, and it's very
I'm
interesting.
in that age group. I'm in that age group where we must, try and distance, that particular document for me to be able to see? Usually after the age of 40, yeah?
If you don't have the right pair of glasses, then you'll find having to stretch out your arms or asking somebody else to read whatever you're trying to read. And then again, once you are over the age of 50, it becomes very important now to have these regular checkups because now you have age-related ocular conditions like your glaucoma, like your diabetes and hypertension-related changes in the eye, all those challenges. And then obviously, once you're over the age of 65, it's only mandatory that you you visit eye care professionals because you've got conditions like your age-related macular degeneration and all that need to be managed very closely.
All right. Now, but you know, you mentioned the importance of seeing a professional eye care, professional like you. Now, from time to time, when one goes to some of these chemists, one sees some, I would say, pairs of spectacles that are sold there. Can you just tell us, the pros and cons of something like that? I mean, you'll see them, some of them is just half lens, others is full lens. And I always wonder, but why? Why are they selling them? Shouldn't these be stuff that one gets from an optometrist? Why are they being sold, at Discam or some pharmacy? I'm just asking out of ignorance, but please forgive me for asking that question.
Putting me on the spot, Pele. Okay, Pele. As you are well aware, is that you can't, somebody cannot just walk into your medical practice and say, may I have a Panado, and then you give them Panado. Then you are in trouble with the Health Professional Council of South Africa, because that prescription is not informed. And as a medical practitioner, you're supposed to check the patient first before you prescribe anything. You don't, as much as it's easy for them to buy it off the shelf, but patients don't understand that you cannot just prescribe that Panadol without checking them. Because if anything goes wrong with that patient later in the day, the narrative will be, I had been to, or my mother had been to Dr. Fundi practice, and he gave him a Panadol. And it may be something very serious and maybe fatal for that matter. So when it comes to this question now about readers, we call them off the shelf or ready-made readers. What happens, Fundi, is that we know that the condition, by the way, that those ready-made readers they are meant for is called presbyopia, which means old eyes. It's the condition that we touched on earlier. It happens from the age of 40 due to the loss of elasticity or weakened elasticity of the lens, the ciliary body, and the suspensory ligaments that run between these two structures. So now, ophthalmologists sat down and they decided that presbyopia is not a refractive condition. It's just an aging condition. For those people that have got normal vision, it will work for them. And even then, they have no guidance as to what strength of lens they should try. It's a trial and error kind of situation. We do not advise that. And I could have it my way, I'll, that practice
Yeah.
is not in line with what you are doing now.
Yes.
To create more awareness about people's eyes and to have those eyes regularly checked by going to buy off-the-shelf readers. You have closed the window of having had an opportunity to have a professional assess the refractive status, number one, of your eyes.
Yeah.
Because those off the shelves, they assume that your refractive status is zero, that you are normal. So if you have not been told that you're normal, even then you won't know which power suits you best. And the subjective view that you have to say that these seem to work better for me, it may be damaging to the eyes if you do not have somebody who
All right.
who is guiding you. And again, we have cited that the age-related changes that happen with the ocular health now, let alone the refractive status,
Yeah.
you have an opportunity for having somebody to look into the back of your eye, view the fundus and all the other tissues of the eye to make sure that there is no there is no condition that is threatening your vision. Because most of the time, these conditions that lead to preventable blindness, most of the time, they're not associated with any kind of pain.
Yeah.
You just wake up in the morning and you open your eyes, vision is gone.
Yeah.
And again, that kind of person would have missed an opportunity to have
Yes.
somebody look at the health status of their eyes.
Lovely. So the key message is people should make use of the professionals, that have to do with eyes, like optometrists,
Absolutely,
and not just pick stuff, from the shelf,
absolutely.
because that may do more, damage than good. And therefore, and you would miss, if there was an underlying problem or something that was already starting in your retina, you would miss that opportunity for that to be identified, because you have treated yourself, and even that treatment may be wrong. So that's the key message, that you are sharing in this segment.
And it also assumes that the status between your two eyes is the same.
Yeah.
And I'm sure, Pele, from your consultations, you
Yeah.
know that your eyes are not the same.
Yeah, my left eye is more troubled than my right eye, and therefore the
Same thing here.
prescription for each eye is different.
Same thing here. And remember, Pele, what is most frustrating is that we need to remember and take everything into context.
Yeah.
You and I, at the moment, we are live on a digital platform. This
Yes.
is the digital age.
Yeah.
My 4-year-old son is already on glasses because he is in an environment which is surrounded by digital platforms
Yeah.
from your iPad, your cell phones, your TV games, and everything. And
Yeah.
his is not fully developed.
Yeah.
That lens is not mature
Yeah.
and it's exposed to blue rays of visual display units and
Yeah.
all that. Those are the kind of things that people, you need to be proactive and say, you know what, my eyes were not meant for this kind of use.
Yeah.
We're using our eyes now the way they were not designed to be used.
Yeah. Lovely.
So
All
it's
right.
very
So
important.
yeah, we have touched on people with chronic illnesses like diabetes and hypertension. We have touched now on the human being from birth all the way up, and at what point should they be having, those eye tests? All right. Now, I want us to get to something that I think most people don't understand. So, and in line with eye care, awareness month, the use of shades. Can you talk to us about the benefits of using the right type of shade? Maybe the starting point is, what is the right type of shade or sunglasses? Because again, there's cheap type and there's expensive type, that is branded. What should one be looking at when you are looking for shades? And what is the benefit of using shades, in terms of protecting and one's eyes?
Okay, Bailey, thanks for that question. I like your choice of words, Bailey. The range from cheap to expensive. My late mother used to say, um, mm, cheap is not necessarily cheap. And unfortunately, it's only after damage has been done that you suddenly realize that cheap is not necessarily cheap.
Yeah.
Mm. Coming back to your question about shades, the reason we recommend tinted lenses
Yeah.
is because we are aware of the climate changes.
Yeah.
There is global movement now to try and intervene, and some of our interventions are already late, but it's never that late. Whatever needs to be done, we need to do it. The ozone layer depletion is posing a serious problem
Yeah.
on the future of this planet and on the quality of our life.
Yeah.
Ozone layer is basically an umbrella that that the creator afforded us to bar certain ultraviolet wavelengths
Yeah.
to not reach Mother Earth.
Yeah.
But because of some of our consumption and our habits, this has resulted in the ozone layer being compromised.
Yeah.
So you find that the ozone layer depletion that scientists are talking about.
Yeah.
Now, the UV light is entering Mother Earth
Yeah.
and it's posing risk to our health and particularly more relevant to our eyes.
Yes.
So when buying those tinted sunglasses, it's important to understand the wavelength up to which you enjoy protection. It should be up to the wavelength of about 400 nanometers. So that is very important. And by the way, we need to emphasize this. Not every dark sunglass has got UV protection. It talks to cheap is not always cheap because
Yeah.
most people, when they buy that sunglass, they think that they're enjoying the same protection as somebody that has got UV protection coated lenses. So
Yeah.
it's very important to make that distinction. That sunglasses are no longer just a cosmetic uh, accessory. Wearing sunglasses that have got UV protection, it's a must for everybody. And it's highly recommended that for those that are wearing uh, spectacle prescription,
Yeah.
it's important to incorporate that into their lenses. And again, um, Ben, it's important to stress most medical aids will say that we are into the business of giving you 6-6 vision, clear vision. As to what the comfort of your vision is beyond that as to what the long-term exposure risk that you are facing with a lens that do not have a UV coating. We are not part of that decision. We don't pay for that. And remember, Ben, you only have two pairs of eyes. Sorry, you only have two
One
eyes,
pair.
one pair of eyes. And these eyes are supposed to last you a lifetime. When
Yes.
a medical aid knows that you'll be with them for a short while, long term, by the time the long term exposure to UV is starting to be noticeable to you, they are already out of the picture.
Mm.
So that falls under preventable blindness as well,
Mm. Mm.
because that cataract due to long-term exposure to ultraviolet light,
Mm.
you do not need to spend a lot of money going surgical correction to take out a lens with a cataract and then put an intraocular implant.
Yeah. Well, somebody like me, I obviously have, problems with, with my lens on both sides, and I've got prescription glasses. But it was recommended that I actually put, the thing that darkens the lenses. They call it transitions,
Yes.
so that when I get into a place where there's the sun, then they become like sunglasses. But when I get inside the room, they become clear. But obviously, that comes at a huge price, But like you say, goedkoop is duurkoop. Cheap can actually be expensive. So I decided, let me listen to the professionals. That's why built in within my lens is actually the ability for the lens to darken wherever I'm in an area where there's sun exposure.
And we are living during the informative age, information age. You can Google these things and read more. If
Yes.
you're diagnosed with any condition, take it upon yourself to go and research. As much as sometimes you don't like Dr. Google when
Yeah.
patients come into your practice and now they want to start prescribing.
Yeah.
We don't encourage that.
Yeah.
But once you've been told by a professional that this is what you have, go and research on that.
Yeah. 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 Now I want to ask you another question. When we watch TV and some of these awards for this, awards for that, we always see these celebrities wearing sunglasses at night. Now, I just want to find out if there's any professional reasons why people should wear sunglasses at night.
Really, it's important to highlight. I mentioned this earlier that sunglasses they are seen as a fashion accessory.
Yes.
Those people are using it as a fashion accessory.
Yeah.
They may be paid, they may be even paid by the manufacturer to wear
Yeah.
those shades.
Yeah.
But again, it's part of the cool image that they
Yeah.
want to
Yeah.
send out there. But most of the time, it's at the detriment of the quality of vision and
Yeah.
social interaction.
Yeah.
If I need to converse with you, some
Yeah.
people they prefer to maintain eye contact, you
Yes.
know. So in some settings, unfortunately, it just doesn't fit in.
No, I just
You,
thought let me ask that question because we see them so often, on TV, and you think, all right, I wonder what's the reason for this. But anyway, no, lovely, lovely. All right, now I'm gonna touch on other. Are there other areas that you want us to talk about around? You touched about something called glaucoma. I want you to just explain a little bit for our viewers. What is this glaucoma you're talking about? in simple language. You know, what is this glaucoma? How important is it that it's diagnosed early? You know, and if it's diagnosed late, what are the likely problems that one can present with, you know, as long-term complications?
Tele, the question that you're asking me, I wish every healthcare provider,
Yes.
every healthcare provider, be it a nurse, be it a doctor, any healthcare provider should be aware of this condition, particularly amongst blacks. It's a well-documented fact. There's still a lot of research that needs to be done as to why it seems to attack blacks more than it does other racial groups. It doesn't matter whether you are a black within the continent or you are residing now outside the continent.
Mm.
Even in America, it's well documented that black Americans, the, the number of blacks with glaucoma is higher than their Caucasian counterparts. So every black person should be aware and sensitized of this condition, which speaks to what we are talking about today, preventable blindness. Glaucoma, simply put, it used to be defined as an elevated intraocular pressure. The structure of the eye is only about an inch in diameter from the front to the back. And within that confine of that eyeball, the pressure inside must be the upper limit. They say 16 to 18 millimeters of mercury. That's the normal intraocular pressure.
The pressure inside the eyeball.
Which has got nothing to do with the blood pressure. We need to separate that.
Yes.
So it's intraocular pressure. Remember, the eye, unlike your soccer ball and your motor tire, which is filled with air, your eyeball is filled with fluid. And that fluid needs to enter at a particular rate and escape at a particular rate, maintaining that pressure within the eye. So what happens is that if that pressure within the eye is high for that particular eye, because it used to be defined as elevated intraocular pressure, which meant that once it's over 20 millimeters of mercury, then we view it as glaucoma. But it's documented, it's a fact. We also have glaucoma of 10 millimeters of mercury, which falls within the normal range. But there are glaucomatous changes in the back of the eye and in the functioning of the patient. Yeah. So that's why now the definition was changed to that pressure which the eye cannot withstand. So now you have to adjust the pressure to give allowance for the eye to function normally. Yes. So that is effectively what glaucoma is. Yeah. And glaucoma, as I pointed, is very common amongst blacks. It's a condition that can happen at any period of your life. Yeah. Some kids are born with glaucoma, which is called congenital glaucoma.
Yes.
You can also develop glaucoma due to trauma. You can also develop glaucoma due to a genetic predisposition, like I've highlighted earlier. So that's why you need to have your eyes regularly changed so that you know what your baseline intraocular pressure is, so that any kind of spike is immediately picked up, and then intervention is sought early. A person that has got, how do you tell that somebody has got glaucoma? Let me give you one example of a bus driver who was brought to my practice because within a space of about a month, he had serious accidents, about 3 accidents, and all of them were on the right-hand side. And this is somebody that had been with the company for such a long time with a perfect record, and all of a sudden, and only to pick up that he had developed glaucoma in his right eye. Usually the visual fields are affected.
Yeah.
The extent to which the eye can see from center to the periphery.
Yeah.
Glaucoma can affect your vision from the periphery, like when you draw the curtains of a screen in a cinema.
Yeah.
So glaucoma acts like that. It acts by just claiming the peripheral vision until such time that a person only has tunnel vision, what we call tunnel vision, where now we're only enjoying like keyhole size vision.
Yeah.
And it was the case with this driver, where he would check the periphery, check the mirror, and when nothing is recorded that there is a car or truck on his right-hand side, he will assume that there is nothing, and then he will just swerve to the right, and
Cause an accident.
that's what happened.
Yeah.
And most of the time, it's not accompanied by any pain. Yes, there are some patients that will feel some ocular changes, and they will feel the pain, they will feel they will feel that the vision is a little bit blurred, eyes are watery. They will tell that there are some changes that are not making.
Yeah. So that stresses the importance of that annual check, because especially for the ones where you're saying there may be no symptom, but the pressure may be raised. And if you don't go for that annual check, you will never know, right?
Absolutely. Absolutely.
Yeah. Right.
Absolutely.
Now, if somebody then does not attend to this problem, what is likely to happen to them, in terms of their vision, long term now?
If you don't attend to it, like the example that I've given you of somebody that of a bus driver that was not aware that he's got this condition, there is loss of life. You know, the reason he was brought to me is because he hit a motorcyclist, and motorcyclist died on the scene. So it's things like that. You need to realize how important.
So you're a danger to society, and you can even be a danger to yourself.
To yourself and to your family.
Yes.
You know, you have a father that is driving the whole family inside the car, not aware of this, and he may just end the life of the whole family. So it is a very serious condition that I need to stress. And it's important that every checkup, even though there may not be changes at the back, but that present to be measured, just to make sure you've got a baseline. And sometimes there may be an elevated pressure before you start seeing ocular changes.
Yeah. Okay. So, but it can be treated. I think that's also an important thing, that if it's identified early, it can be treated.
Easily manageable condition.
Yes.
The range of drugs that are out there, it's a lot of drugs now that are available. If you are not happy with the drug that the ophthalmologist is giving you, go back and have a discussion with the ophthalmologist. Don't take a decision on your own. That no, I'm going to stop using these drugs. because they make your eyes burn or whatever
Yeah.
side effect. As you well are aware that
Yeah.
drugs have got their own side effects. And
Yeah.
some of us, we don't even care to read the leaflet
Yeah.
inside inside the packaging.
Yes.
So it's very important. And Pele, what I would also like to highlight on this platform is that some of the things that you see, you get a patient, you diagnose them with glaucoma, you send them to an ophthalmologist, they get their drug, their first drug. And then the patient says, oh no, I finished those drugs. And he is not aware that it's a chronic condition.
Mm.
We need to highlight that on this platform. It's a chronic condition that needs to be managed every day of your life. You can't single-handedly take a decision to put
To
yourself
just
in the
stop taking treatment.
Absolutely,
Yeah.
absolutely.
All right. Let's
Absolutely.
get to another one, Mr. Gumede. Cataracts. You mentioned something about cataracts. Some of us know cataracts when it comes to old people. You know, in the community, you see that one eye, there's something that is white there. And can you just briefly talk? And here I'm asking not as a doctor, I'm asking, I'm posing questions that an average person, you know, in the community may actually want to know. So I'm playing a devil's advocate. So cataracts, just briefly talk to us about cataracts and why it's important to attend to them.
A cataract, it's important to highlight this, Pele. When you talk about cataract, you're talking about the lens
Yes.
inside your eye. And as you rightly pointed out, cataracts may be due to age, the long-term exposure to ultraviolet light. For example, Bailey, you're old enough to remember some of the window panes, and we used to see them in some buses back then, and
Yeah.
in some houses where you buy a window pane and it's clear.
Yeah.
But after a long-term use, you find that no, I can no longer see clearer on the other side. That depends on the material that window is made of. So what happens is that the UV light, it changes the chemical structure of the collagen fibers inside the lens
Yeah.
from being clear and they become opaque.
Yeah.
And you can no longer see on the other side.
Yes.
And there is no other way to correct that other than just to have the lens surgically removed and replaced with an artificial lens.
Yes. But it's also something that sometimes may happen to younger people who may have other conditions, health conditions like diabetes and things like that.
Yes, the causes of of cataract are very vast, and the most popular one that I responded to was the one you cited, that you see old people
Yes.
with a white eye due to the lens now having changed from clear to opaque.
Yeah.
That's how you usually diagnose
The
cataract.
cataracts. Yeah.
But other causes, for example, a child may be born with cataract, congenital cataract, due to some systemic disorder or due to some chemical intake during the embryonic development. That's why some medication is contraindicated if you are pregnant, because during the embryonic development of the lens, you may be taking a chemical that may affect the lens. It may
Yes.
be due to hereditary conditions. It may be due to some hereditary conditions, genetic disorders. It may be due to systemic conditions,
Yes.
like
Metabolic diseases.
like your diabetes. It may be due to trauma. For example, one patient was hit by a squash ball
Yeah.
7 years back, and all of a sudden I presented with a cataract in my rooms, and upon serious case history, then he suddenly remembered, oh no, I had an accident during the squash game. So yes, trauma is one of them. There is no, it's not only age-related. Yes.
All right. Now, 2 weeks ago or 3 weeks ago, we touched on albinism, and I don't want us to talk too much today about it. Just a minute or two, the importance of eye care when you've got a child who has just been, born with albinism. Just quickly, I don't want us to waste today focusing on albinism because we gave it the whole show a few weeks ago. I just want to emphasize the importance of visual the assessment of their visual acuity and how they must protect their eyes, going forward.
Thank you, Pele. Again, albinism and eyes. What you would like to highlight is the quality of vision.
Yes.
It's a documented fact that the albinism is accompanied by refractive challenges because there is delayed maturity of the visual system because, for example, the iris, which is supposed to regulate the amount of light that enters the eye, it's not giving enough protection to the eye. So the eye is exposed to excessive light, and that excessive light leads to all these visual challenges. And it will also allow UV light to penetrate the eye and then cause all these changes to the lens and the back of the eye. And for now, it's important for somebody that has gotten a child with albinism to take that child to an optometrist or ophthalmologist as early as possible. You look out for the alignment of the child's eye. You look out for ocular movements, how the child control the eye movements, how stable are they? Those are all the factors which we covered during that interview.
Yeah. All right. I think we've covered quite a lot, Mr. Gumede. Now, the questions I'm going to ask now are more light-hearted questions that have to do with trends and fashion, just a few of them. And I just want your view around these things. We often see people who wear contact lenses. If I'm wearing something that is blue, then they've got blue contact lenses. If I'm wearing something that is like green, I've got green contact lenses. So basically cosmetic type of contact, lenses. Sorry, can you just unmute yourself, Mr. Gumede? Right.
Okay.
Can you hear me?
Okay, Ben.
Yeah. So I was saying, there's a trend out there of people having
I had
contact lenses for fashion.
Yeah, it's a very sensitive topic that you are touching on, and it's very serious. What we need to be aware of, as you rightly pointing out, that people will say there were cases that were brought to the Health Professional Council. Particularly, I remember a case of a flea market vendor who was selling a dress which came with the contact lenses. So contact lenses are a medical device, and they should only be prescribed by somebody who is trained in assessing your health and dispensing and training you how to take care of your contact lenses and your eyes. So when you start having people that are selling a dress with contact lenses, immediately that's a contravention of the regulatory laws or guidelines of the country. What's important here, then, is that these victims are called the victims. They go to great extent of trying that dress. Does it fit me? How do I look in it? Are my curves, showing, and they will even seek the opinion of a friend.
Yeah.
But now, when it comes to their contact lens, they just take the contact lens and put it on.
Yeah.
It's important to understand contact lens care. First of all, not everybody is suitable for contact lens wear. You need to assess the physiology of the eye. You
Yeah.
need to assess the composition of your tears.
Yeah.
Unfortunately, we do not have time to go deep into that.
Yes.
Mm. You need to measure the size of your cornea. Contact, just like your shoe.
Yes.
When you go to the shop, you know your shoe size. Contact lenses have got sizes. We call them base curves. So you need to measure the curvature of your cornea to see what size of contact lens suits this patient best.
Yeah.
And speaks to, remember, the cornea is it's a living structure. It needs to exchange oxygen with the environment. It needs to get its oxygen supply from deeper tissues as well.
Yeah.
So if you've got a wrong fitting contact lens, now you find that the eye leads to oxygen, the eye ends up being starved of oxygen.
Yeah.
And then you've got hypoxia. And then once you've got hypoxia, what happens next is that you've got edema of the cornea, which
Yeah.
leads to haziness. It leads to the contact lens now not fitting well, leads to a lot of other conditions. Now that we are only consulted with those side effects or ocular changes
Yes.
that the patient is experiencing.
Yeah.
So before you put, remember, it's a living tissue.
Yes.
Your contact lens become part of your body. And
Yes.
if you not trained properly how to wash your hands, how to handle your contact lens, how to store your contact lens, and all those things, you find that the patient presents with all sorts of infections now because they have been mishandling their contact lenses, they've been leaving them anyhow. Those are some of the challenges that we
Yes.
have. And it poses so much problems. And then when you asked me earlier about the trends and some of the challenges, I said, oh no, Fundi, don't go down that path. Because, some of the stories are so horrific. There's so much
Yes.
drama. There's so much comedy. There's, and we do not have time to go through all of them. But
No, that's fine. But I think the key message is if it's not prescribed by a healthcare professional, an eye care professional, don't use it because it may cause more damage than good. I think that's the key message, right?
Absolutely.
Now,
Absolutely.
there's another issue here. It's also a very fashionable thing. This thing about artificial eyelashes. One of the units within my company, the unit is involved in counseling of patients, or employees of different companies who may be troubled by this or that. So social workers and some psychologists. But at some point, I noticed that the majority of those counselors, for some reason, they all liked to put these artificial eyelashes, and I really couldn't understand why. Well, I was told that it's largely for cosmetic purposes. But my worry was that some of them later would come and say, as they were removing the eyelashes, you know, the glue that attached those artificial ones, they even lost the original eyelashes. So what I want to find out from you, this practice or this trend or this fashion of artificial eyelashes, as an eye care professional, you know, is it something that you encourage? You know, when somebody ends up not having eyelashes, I'm sure God, when he designed the eye, you know, and the eyelids, he had some reason for eyelashes to be there. So if people are removing them now, you know, as they're removing the artificial, there must be some trouble that comes with that.
Really, it's such a challenge. And most of the time, we are consulted when there is such a big issue, when there are complications. We are never consulted before a person does all these things.
Yeah.
It's very important, Pele, like Ada, you mentioned, the creator. When God designed a human being, everything that he has has got this particular function. You need to understand, first of all, the anatomy of the eyelid and understand the anatomy of the eyelash and appreciate what you can, to what extent you can do these things. Number one, it's important to understand that eyelashes, they trap small particles in the air that may harm the integrity of the functioning of the eye, particularly the homeostasis of the anterior layer of the eye, the tear function. So these eyelashes as well, they are placed strategically on the eyelid, and they lead to glands, which are part of the homeostasis of the tear layer. So when you start interfering with all those functions, too much of everything ends up undoing what it's meant for. These longer eyelashes, you'll find them now that they act as now tunnels. Now the air will be channeled into your eye at a greater speed than normal, and it leads to dry eyes and all that. And you find that there's a lot of particles that will be trapped by these eyelashes. And some of these people that put on these eyelashes, they don't know how to take good care of them. They don't take them out, they don't clean them. Some of the chemicals that they use, they harm the eye. Sometimes they exceed the lid margin and start interfering with with the eye function. So it is a serious problem. Eyelashes, they take on average about 2 to 16 weeks to regenerate, because when you start pulling them the wrong way and you unplug the contact, the eyelash, you may cause scarring and may cause now challenges with the distribution of the secretions of the gland which are inside the eyelid.
Okay. No, all right. Yeah. Now we are looking at wrapping up. You know, I think we've covered most issues, but I just want to ask you about this one. You know, there are people who have what we refer to as hypersensitivity. That is, people whose soldiers are very sensitive and as a result, they may present with asthma, they may present with hay fever, they may present with skin allergies and stuff. Now, a few times, during my years, of practice, I would come across people who use, what do they call them? Mascaras. These things that actually make the eyelid to look darker at the edges. And some of them would react, to these, and then they come with swollen eyelids. Can you just talk to us about that?
No, it's we are seeing a lot of complications as a result of that. The most recent one that comes to mind is a lady that used your hair dye to dye the eyebrows.
Yeah.
And that led to serious complications of the eye. The eye was swollen, purulent excretions, a lot of complications. People, they just get into these things without applying their mind.
Yeah.
And the people that use them, they don't follow instructions.
Yeah.
And with that, what I would advise the general public for is it's very important to read the back of the package or that leaflet that comes inside the package. And when you have complications because of all those things, it's important that when you seek help and you come to us, you bring that leaflet so that we can understand exactly what's the chemical composition of the product that was used that led to this kind of insult on the eye. So people need to understand that such things like your mascara, some of them are water-based, some of them are liquid-based, and the water-based will tend to wash easily, and some of the oil-based ones they will last longer and they will trap a lot of other antiviral debris on them. The most important thing that I need to highlight here is that there are certain guidelines on how to use these products. The one cardinal rule: be selfish with those products. Don't share those products even with your family, because that's how infections are transmitted from one eye to the other and from one individual to the next. And I would discourage the general public to use those samples that are available in the store, because you don't know the person who was there before you and applied that product. So those are some of the important things that the general public need to understand. Like, for example, if you open any eye drop after 30 days of use, you discard that eye drop. It's the same thing with these products. The closer you get to the eye, you need to patch those products. At some stage, you need to say, this thing has been lying here for so many weeks. And it's been collecting. Remember, that medium is the perfect medium for microorganisms to develop. So when you start applying all these products on your eye, you're also introducing microbial infections, which are available to that.
All right. Mr. Gumede, unfortunately, we have run out of time, but I just want you, for the last 2 minutes, for you to just give overall. Remember, we have in this session, as a result of the fact that this is Eye Care Awareness Month, right? From the 21st of September to the 18th of October. So we're just in the middle of the Eye Care Awareness Month. So is there anything that you want to emphasize again to our viewers? Something that you might have said before, or something that you have not yet said, but something that they need to keep in mind, so that they can protect that set of eyes that they were given by God, so that it can last them for as long as possible.
Well, first of all, I truly would like to congratulate you for all your effort in bringing awareness to the people how to better take care of themselves. And when it comes to Eye Care Week, I need to emphasize you only have two pairs of eyes.
One set.
You only have one pair of eyes, but two, you only have two eyes,
Yeah.
and they are supposed to last you a lifetime. And you cannot engage into any risky habit, unnecessary risky habit, because when the complications affect those eyes, it's very sad when you start having to counsel somebody who's lost vision or their eyes. Because, for example, these people that put mascara when they are driving, and all of a sudden they have to brake while they have their pen in front of their eyes and they scar the cornea.
Yeah.
So it's very important that people take better care of their eyes. And it's very important that they seek help before they engage into some of these habits. And remember, you have to test your eyes every year to rule out anything that may threaten the clarity and coordinated vision that you need to enjoy in your life.
Thank you, Mr. Gumede. So on the last issues that I asked you about, which are really related to fashion and trends, what you are saying is that as much as people say you suffer for beauty, but there are certain, beauty trends that you don't have to follow because they may cause more trouble than good.
There are limits. There are truly limits. You need to seek the help of a professional eye care provider. You need to make sure that you have somebody who is trained in the use of that product, and that will warn you of what the contraindications are and what sort of side effects to expect. Find out from the person that is applying those things. Some of the things that we see in our rooms are horrific.
Yes. Thank you very much for giving us your time, Mr. Gumede. I know this is the second time in less than a month that I'm calling you here, but it's because, the inputs that you share with our viewers are so valuable that, we will not get tired of calling you. Whenever you are available and we need somebody of your expertise, we will definitely invite you. But where can people, come and see you? You are based in Durban, right? Your practice is in Durban, but where exactly in
Billy, I'm based in Devon for the past 25 years. I'm in Pine Street, what is now called Montenegro. I am right next door to Woolworth on the Pine Street end. And unfortunately, sometimes when people come to my rooms, they expect to see me along Pine Street. I'm in a recessed entrance that leads to Woolworth. So a small passage that leads to Woolworth, and I'm right next door to them. I trade six days of the week, Monday to Friday, 8 to 5, and on Saturday, 8 to 1 o'clock. And it's very important that on Saturdays in particular, it's a short day. So I would encourage them to make appointments, and we are available on 031 306 2988.
All right. Are you available? Do you have a website for the practice, or are you available on social media for those who would like to send you messages? Obviously, they won't make bookings via, Facebook and stuff, but at least, for them to be able to follow you and the advice that you give from time to time.
Yes, we are available on the website. Our website address is www.sbukumedeoptometry.co.za. However, this weekend they are maintaining it. We'll only go live latest by tomorrow, by Monday. Sorry.
All right.
And we are available on Facebook, Sibukumede, as well as on Twitter. And they are more than welcome to reach us.
Yeah. All right. Is it SPU as SIBU or SBU?
SPU, Sibukumede Optometry.
All right.
Because I'm popularly known as Sbu, so I decided to keep it that way. Otherwise, the name is Sibusiso, but
Yeah.
you know the street name is Sbu. They shortened it to Sbu, Sbu Gumede. Yeah.
Thank you very much, Mr. Gumede. We appreciate your time, and we appreciate your professionalism. We appreciate, the depth of knowledge that you have shared with our viewers, and may your practice grow from strength to strength. Like I said, it's not the last time that you are coming here, onto this channel. But for now, enjoy your weekend.
Thank you very much, Pele, for inviting us. And may your channel grow as well, and may more and more people join your channel and use this platform to learn more about how to take better care of themselves. And I really congratulate you for your effort. Thank you very much.
Thank you very much. And I also want to say thank you to all our viewers. Apologies that we didn't go through, or go live exactly at 4 o'clock. There was a problem with our technology, but you did not miss anything because we basically repeated everything that you had missed in the first 15 minutes when we went live. So thank you for your patience and thank you for being with us. Goodbye.